Children can develop sniffles, sneezing, and coughs any time of the year, although it may seem more common during winter months. If you're trying to look out for your child's health, Doug Johnson explains that it's important to know when those symptoms are part of an actual illness.
It seems like colder temperatures and the changing of the seasons bring on more colds. It's directly caused by the cold. We stay inside more when the temperature drops. That makes it easier to catch what someone else has. Although not feeling good isn't always a full-blown illness.
We get the sniffles as the weather changes, and sometimes even a little sore throat might come with a runny nose. And it doesn't necessarily mean that that is an infection or illness per se.
9-year-old Mary Faith Sharp is in the office to see Dr. Geiger today. She's been under the weather for a few days now.
I've been feeling, kind of in the middle.
Well, she's had a cough for about a week, and it's gotten worse. She came home from school yesterday and had a 101 fever. Didn't have a fever today, but thought we'd better bring her in just to be on the safe side.
Duration and intensity are a couple of the things parents should look for when they're trying to determine whether their child has a change of season sniffle or something more serious.
When we talk about children, I think of the three main things: eat, sleep, and play. So in general, try to look at their day-to-day routine, how the appetite is, sleep, whether there's disruption, and their general disposition, playfulness, energy.
Cold weather doesn't cause a cold. Drops in the temperature don't weaken your immune system, and the cold virus can make the healthiest person sick. But changes in the weather can cause symptoms that may mimic what happens during a cold. Cold air can make the nose work a little harder, causing it to run, which can cause sniffles, but that's usually not serious. A cold is caused by a virus and can last 5 to 10 days. There can be clear, watery discharge from the nose. It can thicken and turn white, yellow, or green, then clear again after several days. A daytime cough may get worse at night, and kids may have a low-grade fever. If it's a cold, make sure kids get plenty of rest and liquids. A humidifier at night can keep their nose and chest clear, and acetaminophen or ibuprofen can lower fever and reduce aches. Bacterial sinusitis may have cold-like symptoms, but can run 10 days without getting better. Children can have thick yellow nasal discharge and fever over several days. They can also suffer from headaches behind or around the eyes. The doctor may prescribe an antibiotic to treat that infection. Kids may also need acetaminophen or ibuprofen for the headaches and saline nose drops for the nasal congestion. Parents shouldn't automatically ask for antibiotics when their child is sick. The pediatrician can do a better job of figuring out what type of problem a child is dealing with by tracking their symptoms first. In Mary Faith's case, she felt more of an impact than just a sniffle, especially when she was more active.
Sometimes whenever I have PE, it makes my head hurt a little bit. And sometimes I have gymnastics after school. So that kind of makes my head hurt a little more.
So, if a child's nose runs when the temperature drops, keep an eye on them. You may only need a trip to the pediatrician if it lingers and if their condition gets worse. For Smart Medicine, I'm Doug Johnson.